So, let us now continue to our second topic for this week, the overview of the nature of professional nursing care. Okay, so this includes the roles and function of the nurse. So, this was actually discussed last week, no? The roles and the functions of the nurse, the different roles. Wherein the first one is as a caregiver. Yeah. So wherein the nurse assists the client physically and psychologically, and of course the framework in providing care to the client is you have to utilize or use your nursing process. Okay, so as communicator, so inulit-ulit na lang natin to, no? This is just a recap or review in our previous discussion last week. As communicator, the nurse should identify the client problems. That is how. So, of course, by assessing the client. And the nurse should be able to work with other professionals and people in the community. So, why? Of course, to communicate with other professionals about the status or about your assessment of the client, you have to remember that as a nurse, you are at the bedside of the client 8 to 12 hours, while the doctor will just visit or do the rounds in the morning or could be in the afternoon, less than an hour. Actually, 10 minutes, 30 minutes is more, that's too much na sa kanila to spend with the client. So, usually, very short lang yung time nila with the client, while you as a nurse, you will be at the bedside of the client. So, you should know kung ano yung mga assessment mo about your client. You should communicate it with the doctors or other member of the health team and the people in the community. If of course, as a nurse, you can give information to the community, especially if there are issues like the COVID-19. So what are the how to prevent, okay? So how to promote health. So you will communicate, okay, informations. And as a teacher, so nurse acts as a teacher too. So you have to learn about their health, about the current situation of the client, and then you assess the client's learning needs and readiness to learn. And then, pag alam mo na that you have your assessment and you have assessed the readiness of the client, you can set a specific goals, and enact learning strategies and of course, and measures their learning. You need to evaluate if the client really understand what you are teaching to them. And you can ask the client to demonstrate it. Halimbawa, you're teaching the client how to care for his or her wound. So you can ask the client to demonstrate how to do it, so that when the clients will be sent home, they know how to perform wound care. So that is just an example of health teaching, upon discharge of the client. And another one is as client advocate. So as client advocate, you have to protect the client. Ano ba yung protect mo sa client? The client rights, and you have to protect the client's further complications of the current illness. And you have to represent the client's needs and exercise. You help the client to exercise their rights and help them speak up for themselves. So it's more of support, diba, sa client. And as counselor, okay, you have to recognize and cope with stressful psychological and social problems. You have to help the client how to cope those kinds of problems, and you have to provide emotional, intellectual, and psychological support to the client as counselor. As change agent, okay, you can be a change agent by helping the client or making modifications and helping the client with the changes. Kasi, for example, merong magkakaroon ng changes doon sa lifestyle ni patient, you have to modify the lifestyle of the client. You have to help the client Also, changes in the healthcare system, technology change, age of the client, population, medication, etc. So, napakaraming modifications. Maraming changes sa client, especially if the client has present illness or na-diagnose na may diabetes or hypertension. So, pag uwi niya sa bahay, o kailangan niya i-change ang kanyang lifestyle, ang kanyang diet. So, you can help with the client, no? So that you will be you can practice your role as a change agent. And as a leader, okay, as a leader, you have to influence not only the client but as well as your other co-worker, okay. And it is very important that understanding the needs and goals that motivate people. So you have to have a knowledge to apply the skills, and you should have a good interpersonal skills. As manager, so you can delegate, supervise, and evaluate. No, you can delegate tasks to other member or other nurses. Okay, you can supervise and evaluate if the care given was effective or was performed or done correctly. It requires knowledge and organizational structure, of course, among others. Case manager. So, you have to work with a multidisciplinary healthcare team, and you have to work with primary or staff nurses to oversee the care of a specific caseload. So, merong specific case. Okay? So, marami kang pakikisamahan dito kasi you are managing a specific case of a client. So, pag sinabi natin specific case, ano ba yung specific case? Illness of the client. Okay? And the status of the client or response of the client. As a research consumer, so use research. As a nurse, you have to use research to improve client care. And you have to have an awareness of the process and the language of the research. Be sensitive to the issues related to protecting the rights of human subjects. So, ethical issue dapat ma-address mo. Participate in the identification of researchable problem and be a discriminating consumer of research findings. You have to apply research into practice. Okay? Expanded career role. So, napakarami pang roles din nurses, no? As nurse practitioner, clinical nurse specialist, nurse anesthetist, nurse midwife, nurse researcher, nurse administrator, nurse educator, nurse entrepreneur, and forensic nurse. So, it's up to you. Ano daw ba ang pinaka-highest paying nursing careers? Okay. So, ang pinakamataas is certified nurse, registered anesthetist, CNRA. So, later on, baka gusto nyo maging CNRA. Okay? So, let us now move on to the Benner stage of nursing expertise. So, ano ba yung alam nyo dito? I'm sure, dinaanan na rin natin to during your TFN. Okay? So, stage 1, according to Benner. So, may tinatawag tayong novice. So, na-discuss ko na to during your TFN. So, babalikan lang natin. So, when you say a novice, of course, a person doesn't really have any experience. Of course, because wala siyang experience, the performance is really limited. So, the rules and objective attributes must be given to guide the performance. So, dapat may rules and objective. Second one is the advanced beginner. So, when you say advanced beginner, a person can demonstrate a marginally acceptable performance, and the person has enough experience to grasp aspects of the situation. And competent. So, at least 2 to 3 years experience in a specific area, and can differentiate important factors from less important aspects of care. There is an increased level of efficiency in this stage. And in stage 4 is the profession. Okay, so at least merong 3 to 5 years of experience in a particular area. So perceive situations as a whole, and there is much more involvement with the patient and family pagdating ng stage na 2. And then it focuses on long-term goals. So, hindi na yung mga short-term goals. Ano ba example ng short-term goal and long-term goal na gagawin nyo later on doon sa nursing process? Pag sinabi natin short-term goal, ito yung, like for example, pababain mo lang yung temperature, so mabilis lang yun, pupunasan mo si patient, iinom ng paracetamol, bababa na ang kanyang blood pressure. Pag sinabi natin long-term goal, ito yung hindi ka agad-agad within an hour makikita mo yung result. Could be in 1 day or could be in a week or more 3 days or more. So, ganun yun. Sa pagka long-term yung goal mo, ano ba yung example nun? Halimbawa, si patient, makakalakad na siya. So, after surgery, so, makalakad na siya ng maayos. Yan. So, medyo matagal kaya long term kasi medyo matagal yung process nun. And the next one, or the last stage, but not the least, of course, is the expert role, or the expert stage. So, the performance in this stage is flexible already. So, and the person or the nurse is able to identify the region of the problem without wasting consideration. Okay, so for the nursing student code of academic, so National Student Nurses Association Code of Academic and Clinical Conduct. Okay, so you can do a research on this and do a self-study of what is NSNA Code of Academic and Clinical Conduct, or National Student Nurses Association. Okay, so the Code of Academic and Clinical Conduct. Okay, so dapat self-study lang yun, no? But then let's proceed na here, okay, para mas maintindihan ninyo. So, nursing students have a responsibility to society in learning academic theory and clinical skills needed to provide safe, quality nursing care. So, that's very self-explanatory. This code is based on the understanding that to practice nursing as a student is an agreement to uphold the trust society has placed on us. Okay? This provides guidance for nursing students in the personal development of an ethical foundation. So, ito yung code. Okay? And this is not only limited to the academic or clinical environment, but can also assist in the holistic development of the person. So, ano ang mga clinical conduct of the client? Of course, advocate for rights of the client. You should act as an advocate or to protect your client, at the same time to support your client. So, meron tayong advocacy. So, rights of the client. So, dapat ma-practice yan. You have to know what are the different rights of the client and let the client know their rights. And then, maintain client confidentiality. So, under this is, of course, confidentiality. So, alam natin yung confidentiality, or privacy, academic setting, and special conferences. And you have to take appropriate action to ensure the safety of the client and self and others. So, appropriate action to ensure safety of all client is under this, and safety of self and safety of others. So, that's the conduct, ethical conduct, no? Provide care for the clients in timely, compassionate, and professional manner. So, timely care, compassionate care and professional care. So, that is very self-explanatory naman. Time, please. Dapat on time. Hindi ka nalilate in providing care to the client. Compassionate, you have to do it from your heart, no? May care. And professional is, of course, you have acquired or you have applied the knowledge and the skills and the attitude that you have gained or learned in your nursing journey in the school, diba? Communicate the client care in truthful, timely, and accurate manner. So there should be truthful communication, timely communication, and accurate communication. Then actively promote the highest level of moral and ethical principles and accept responsibility of our actions. And under this, you have to promote the highest level of moral and ethical principles of the client. So, accepting responsibility for our actions. So, you are responsible for your action. And number 7, promote excellence in nursing by encouraging lifelong learning and professional development. So, under this is, of course, excellence in nursing, encouraging lifelong learning, and professional development. So, this is, again, very self-explanatory. You have to treat others with respect and promote an environment that respects human rights, values, and choice of cultural and spiritual beliefs. And under this, you need to treat others with respect. Promote an environment that respects human rights, values, and choice of cultural and spiritual beliefs. Number 9, collaborate in every reasonable manner with the academic and faculty and clinical staff to ensure the highest quality of client care. So, it should be a collaboration, no? Collaborate in every reasonable manner. Use every opportunity to improve faculty and clinical understanding of the learning needs of nursing students. So, nursing is a fast-paced, ever-changing field that leaves little or no room for error. So, dapat hindi kayo magkamali. So, encourage faculty, clinical staff, and peers to mentor nursing students. You have to encourage faculty, staff, and peers. That is, to teach the nursing student. Refrain from performing any technique or procedure for which the student has not been adequately trained. So that's why you have your FNP RLE, wherein actually if we are on face-to-face, you can experience our RLE room, okay, wherein you will be trained of different procedures. Na i-practice nyo muna yan before going to the field and applying it into your client. Operating with appropriate scope of practice. And of course, number 13, refrain from any deliberate action or omissions of care in the academic or clinical setting that can create unnecessary risk of injury to the client, self, or others. So, academic or clinical setting, under this, the creating clinical risk of injury to the client, self, or others, and refraining from any deliberate action or omission of care that creates unnecessary risk to the client, self, or others. Assist the staff nurse or preceptor in ensuring that there is a full disclosure and proper authorization are obtained from clients regarding any form of treatment or research. So, under this, you have to assist staff or preceptor, ensuring that there is full disclosure about the situation of the client, the illness, or the diagnosis of the client. Proper authorization are obtained from the client and regarding any form of treatment or research. Okay? And 15, abstain from the use of alcoholic beverages or any substances in the academic and clinical setting that impairs judgment. So, under this is abstain from the alcoholic beverages or any substances that may impairs judgment in the academic and clinical setting. So you have to strive to achieve and maintain an optimal level of personal health. So under this is optimal level of personal health and striving to achieve and maintain. Support access to treatment and rehabilitation for students who are experiencing impairment related to substance abuse and mental or physical health. So, dapat may access to treatment, no? And rehabilitation for students na mental or physical health issues. Uphold school policies and regulation related to academic and clinical performance, reserving the right to challenge and critique rules and regulations as per school grievance policy. So, ito yung mga under naman itong level na yun. And that actually ends our topic for this week. Thank you so much. And God bless you all.